Well, good morning to you, everybody. It's Dr. Brian Prax. I don't have my sidekick, Dr. Jennifer, here with me today, but I'm lucky because we have medical doctor Casey Kerrigan here with us. So welcome to the show, Dr. Kerrigan.
Oh, thank you for having me.
It's awesome to have you. So Dr. Kerrigan is the chairman of OESH Shoes here locally in Charlottesville. She's an MD from Harvard Medical School with a specialty training in physical medicine and rehabilitation, and the former professor and chair of the Department of Physical Med and Rehabilitation at UVA. So welcome. We are so happy to have you here.
Oh, thanks again, Brian.
Yeah. So you and I were talking as you graciously gave me an incredible tour of your amazing, what do you call it? Factory? It's a factory. It's a shoe manufacturing factory here in Charlottesville, and it is one of the most unique things that really I've ever seen. But what I'd like to do today for our listeners is to maybe tell us about you, your history, and then how did you get all the way down from a doc to making shoes?
Like how I became a cobbler? Right?
How did you become a cobbler? How did you become a cobbler? Yeah.
It's a long story. How much time do we have?
We have about 30 minutes on this show. Go ahead.
Right. So, so my specialty is physical medicine and rehabilitation, which, as we were talking earlier, I think physical medicine and rehabilitation is the closest specialty to being a chiropractor as there could be, I think.
I think that is, yeah, if you could go a little bit more into that, because I was telling people my excitement about interviewing you, and people are like, physical medicine and rehab, a doctor, what is it, physical therapist? What is she?
Right.
And so, what do you guys do?
What do we do?
Yeah.
So, I was thinking, because tomorrow I'm giving the commencement speech for at Emory University for the graduating residents in physical medicine and rehab, and all the parents are going to be there. And they're going to be wondering, what did my child spend the last 4 years doing?
Yes.
So so this is how I boil it down. I say, we're function doctors. We're about preventing diseases. And we're interested in the whole body.
Yes.
We may be the only specialty that is not focused on either one organ system or orifice.
That's true. That's true. Yes.
With
that's
the
right.
orifice.
That's right.
So but we consider the entire body and the environment that it's in.
And we talked about that. When I got a view and a tour of the cobbler's facility there, it was phenomenal. But the first thing that I noticed when I walked in with the tour is we stopped. And you had me turn right, and you showed me this wall of research. You got all this research up here, and I think your name as the lead author on many of those was on all of these papers. How many papers do you have out there on research?
Well over 100.
Oh, there wasn't even 100 there, but it was a lot of them up there. And the ones that we looked at, of course, I guess obviously are related to feet, footwear, how we move as humans. Am I right on that?
Correct.
Yeah.
Correct.
Yeah.
Yes.
So I saw some that were amazing, jaw-dropping. I didn't have a chance to research those and really take a careful look at those. But let's go back to, again, going back to one other thing. You guys really are more like a chiropractor. And so welcome to our group of crazies, because we also see a human as a human. And I tell patients all the time, I work with peripheral neuropathy and knee pain and all that, and chronic conditions and diabetes and people that are overweight, and I say, you know what, I literally have no idea how to grow a nerve. If somebody's got lost nerves or numbness, I don't know how to, and I have no clue how to grow a nerve. It's like I don't have any idea how to grow a blade of grass. But the beautiful thing is that the body does. And that's always been the chiropractor's philosophy, is that there's an inborn, innate wisdom of the body that it knows best. A lot of times, if we just get out of the way, do a couple, show people some guidelines and some rules to live by, and a lot of those have to really kind of boils down to two main categories: eat really well and exercise. So I think in the realm of physical medicine, we talking exercise and we're talking movement.
Absolutely.
So tell us again. Let's go back to this whole cobbler thing. Medical doctor, cobbler now. So why couldn't you find it? There's no shoe out there that you could find based on your research to do what you think humans need to do?
Right. So At the time, I was studying gait. So gait is the study of walking or running. And the biomechanics, the physiology of that movement had really not been studied. When I started in the early 90s, there were not very many studies. And just understanding what that basic physiology is and trying to get to the bottom of it with these three-dimensional cameras around. So we had a laboratory with these cameras, and then we had we were measuring muscle activity, all sorts of, and then all over a force plate. So we were getting oodles and oodles of data, and trying to make sense of it in light of what we were seeing in the clinic, or really what are the general problems, what are the general musculoskeletal problems that people have, and what are the most debilitating. And again, this is over the whole course of we're looking at the whole body. And one of the things that was clear to me was knee osteoarthritis. And knee arthritis, it was the number one disease it still is, that we treated in physical medicine and rehabilitation.
Yep, we see a lot of those too.
And it fills up the outpatient clinics, it fills up the inpatient clinics, what's the end stage of knee osteoarthritis is a knee replacement.
Yeah.
And so people coming in and getting knee replacements and requiring rehabilitation for that. So I was putting all this kind of, it's always in the back of my mind. And again, we were looking at everything, but knee arthritis was, and then I'm studying gait, and just kind of on a lark, we threw some high heel shoes on some women and said, kind of, what happens here?
What would that look like?
And guess what? Everything is screwed up. Well, the hundreds of parameters that we have.
Oh, no.
Like everything, like name something that isn't affected with the high heel shoes.
Okay.
So we're messing everything up. Okay. But I'm looking at this one parameter in there, and it is called the knee varus torque, or the knee adduction moment. And I'm looking at this thing, and it's 26% higher in these high heels compared to barefoot. And I said, wait a minute, isn't this the same parameter that we, pat ourselves on the back for when we try to reduce it by 5%? And we have a patient go through this, invasive tibial osteotomy surgery to try to reduce this torque by 5%. We think we're so great.
Yeah.
And here I'm seeing this huge percent with high heel shoes. Oh my gosh, this is significant.
So break that down to English. What do you mean? What are these high heels doing to women? I was going to say us, but that's back in other days. Okay,
we'll get to men's shoes in a minute too.
Okay.
Right. So what I found is that the shoes are altering where the forces are on your knee, such that they're increasing the pressures, the loads, the pressures in the exact areas that we get knee arthritis.
Okay, so you're seeing knee arthritis, and you're seeing where the arthritis is happening, and you're seeing that the high heels, or even the elevated heels, is creating the same forces which are breaking down in the knee.
Correct.
Is that right?
Correct.
Wow.
Yes.
Yes.
Yes. So I see that, and I said, oh my gosh, forget about all these other parameters. This one's kind of clinically significant. I can't just sit on this one.
Huh.
And then shared it with friends. And at the time, actually, I didn't know that women have twice as much knee arthritis compared to men. It was I was just sharing the data with a orthopedic surgeon friend of mine, and he said, holy crap, like this explains why, most of my patients are women. And has anybody ever documented this?
Stumbled on this. Wow.
So of course we found epidemiologic studies that show, yes, indeed, knee arthritis is twice as common in women.
Wow.
When it does occur, it occurs in both knees, not just one. Usually in a man, it's because of an old football injury or something.
Yeah.
But in women, both knees. Oh, could footwear be the culprit? Yeah, I think so.
This is what I've found, Doc, but oftentimes, and tell me what you found, but from my perspective and the patients who come in for my knee program, I often see the knee. You can take an x-ray, you can see the ramifications of the knee, but I usually find, and maybe it's my chiropractor whole body training, but I often find that the poor knee is just the victim. The guy in the middle, it's usually related to something going on in the foot. And now you're saying, well, yeah, it could be something that's on the foot, like the shoe, or I should say, or having to do with something going on in the hip, the pelvis, or even the lower back. Do you find that too? And that poor knee is just in the middle.
It's in the middle, absolutely.
It's the victim.
Yes, it's the victim.
Yeah.
It's the victim. And there's other things going on. So yes, exactly. So footwear. But just like, we're measuring this one thing at the knee, the knee, and that's got a lot of medical relevance and a lot of studies.
Yeah.
But imagine, it's doing the same thing to every other part of the body. It's causing these abnormal increased loads, muscles, tendons, ligaments throughout.
Yes.
But we're gonna focus on the knee. Just focusing on the knee alone, knee arthritis causes more physical disability than any other singular disease in the elderly.
Yes.
So, and people don't understand that. It's not as noticed. It's, people, we get on, other medical diseases, but that's sort of the lost one.
It's debilitating.
Yeah, but it's debilitating, and people just live
Nobody really
with it.
dies from knee pain, like they would with cancer or diabetes or something like a heart condition, but it can really suck the joy out of your life.
Absolutely.
Yeah.
Absolutely.
Hey, if you're just joining us, this is Dr. Prax with Dr. Kerrigan here. She's the chairman of OESH Shoes. And we are talking about footwear, and right now we're talking about high heels and the damaging effects of that. So if you're joining us and you missed it, you really did miss out. But don't worry, you can go on to WINA. They have this. We're loading this up on the podcast. I also have a YouTube channel. You can check it out there. I don't want to waste any more time though, Dr. Kerrigan. One thing caught my attention. A lot of things caught my attention, but you said, wow, we found out it just wasn't affecting the shoes. The footwear wasn't just affecting the knee. You said it was affecting other areas of the body as well, and we call that the kinetic chain, which I like to talk to my patients in plain English, and that basically comes back to your old song that we learned a long time ago, that the foot bone's connected to the knee bone. I mean, isn't that the kinetic chain, that it's all connected?
Yes, absolutely.
Right? So what do you mean that my high heels, or my wife's high heels that she wears, what do you mean that's affecting the knee? We talked about that, but what else? Like, are you talking hips, pelvis as well? And what else?
Absolutely. You can sort of boil down all the common musculoskeletal injuries that we have. Can be related to those loads and how those forces are applied. And I don't want to get too technical, but it's like we've been focused on just what the looks, the motion, and how sort of the anatomy, and not on the underlying loads and forces causing that. And so that's what we're
focusing on the anatomy and not as much on the physiology.
And the physiology.
So well, you'll go in. The patient often comes into my office or the doctor's office and say, I got owie right here, and they're pointing to the hip, right? And so the doctor says, oh, okay, well, let me feel that. Oh, it's sore. Oh, there's swelling there.
Right.
Let's take an x-ray. Let's take an MRI. And sure enough, you take an x-ray and MRI, and you go, look at there, you have arthritis.
Right.
The doctors, the surgeons are so fast just to say, well, there's a problem, you have arthritis. Well, what's the cause of the problem?
Exactly.
What's the cause of the the problem? And so what you're saying is that often hips, knees, backs, maybe even necks could go all the way back to the feet, or the mechanics down in the feet. Is that what you're saying?
Right.
Yeah.
And not to belittle exercise and all. Exercise, fantastic, and
yes.
But here, so more of the story kind of involved in the research. So we've got these high heel shoes, and then and this, by the way, hit the press. Oh my gosh, this was before the internet. It's 1998. This was published, and it was on 2020. I had Barbara Walters. All these people calling me, just like, can we do an interview? They did a 2020 episode. I'm trying. Gosh, all the reporters. Anyways, and I was sort of tongue-tied, like, oh my gosh, I don't know what these are high heel shoes, and it came out that it was published in the Lancet, which is one of the most prestigious medical journals in the world. Yeah. And I was like, oh my gosh, I haven't really done. I need to do a lot more research,
Okay.
I can't explain why the high heel shoes did this. And I need to go back and look at like men's shoes and other types of high heel shoes,
Whoa.
and not stilettos, but other footwear, and see what the effect
Yeah.
is. And
Yeah.
that's when I started digging in and studying all these other shoes, when I found that, you know what, these loads still exist. It doesn't have to
Okay.
be a stiletto high heel shoe.
So you have some sample shoes, and if you're watching on YouTube or Instagram, you'll be able to see these. But if you're listening, Doc, you're going to have to do a
Yes,
good
yeah,
job
yeah.
describing.
Right.
But again, for those of you who are listening, you can go onto my YouTube channel. Just look up Dr. Prax, P like Peter, R-A-X, and then you can see these. But why don't you go ahead and describe for the listener what you're talking about
Right,
there.
so when we published, it was in 2-inch stiletto heels, and then shortly thereafter, that was published in the Lancet, and then shortly thereafter we looked at wider based heels, like chunky heels. We saw basically the same thing. In fact, a slightly more increase in the torques, in the loads.
Yeah.
And I think at that point I thought, oh, it's because you feel more comfortable on this sort of more stable base of support.
Yeah.
So that's altering your forces even more. So then we started looking at, okay, what about just moderate heeled shoes? So we
Okay.
went and we looked at something like this. Now this is actually a pretty high heel, but this increases the loads really to about the same extent
What are you
as a
holding there?
stiletto. This is just a typical moderate heeled
We don't want. I guess
woman's
we don't want to
shoe.
say the it's kind of like a
Yeah,
clog.
it's like right.
Can we say
right,
that it's
right,
a
right,
clog?
It's like a clog.
Okay,
It's
so
like
we're
a
not
very
wanting to put
popular
any brands out. The
clog.
very popular clog.
Very popular
You see a lot of
clog.
doctors and nurses. My wife wears
wear
these
them,
things.
and
So
thinking that they're
rhymes
that
with
they're
Pansco.
healthy.
all right, but so okay,
Yeah.
so what we're seeing here for the observer and for the listener is, what would the difference be there? Are we talking maybe a half of an inch there?
Yeah, there's
What would
probably
you say? An
even
inch
a half.
maybe?
There's probably a
Okay.
whole inch here, but
Okay,
even
one
like
whole inch
3/4 of an inch
difference. It's
Yeah.
higher at the heel as it is at the forefoot.
Yes.
And what you're telling me is that is altering the load, the way we walk and how the mechanics work in a negative way.
Correct.
That's impacting our knees and our hips and our back and the whole body.
Yes.
So even something as minimal, and I guess that's not really minimal, an inch, but something like that. Talk about this shoe here, and that's just, it looks to me like a regular running shoe, kind of like
Yep.
the one I own.
Yes.
Okay?
Yes.
So it's a running shoe, and what about that?
So even any elevation in the heel.
Any elevation.
elevation in
Okay.
the heel will increase.
Okay.
Now it's to a degree.
Yeah.
This won't obviously increase the loads as to the extent as a 2-inch stiletto,
Okay.
but it still does.
What would you say that is? Are we talking?
That's probably a
quarter?
half inch.
Half
It's
an
a
inch.
half an inch.
It's a half an inch.
Yeah.
Why do shoe manufacturers do that? Is it because we want to make our men and women feel taller? Is it more cush on the heel? Why do we elevate that?
I think it goes to a premise that we've demonstrated to be incorrect, that when your foot first lands, you land on your heel,
Yes.
that you have this big impact force that causes all of the injuries and arthritis
Okay.
and all of that.
Yes.
Well, we've found that little impulse, that little tiny, it's actually a little blip that
Okay.
occurs.
Hmm.
That's what it is. It's just a blip.
Oh man.
It's insignificant.
Yeah.
And in fact, if you translate what that little blip does
Yes.
to all the forces, it's actually going in the complete opposite direction of where we even get the injuries.
Oh no.
So if anything, I would say that it's protective. And there's some data to demonstrate that
Okay.
having that promotes bone density and tells your body, yes, I've hit the ground
Yes.
and I'm going to respond with reflexes
Yeah.
and all that. But basically by itself, that's what's not causing. That's not causing these elevated loads. What is causing the elevated loads is when your foot is fully planted and your body weight is over that foot. That's
Okay.
in mid stance.
Okay. Yeah. Gotcha.
And that's when those loads are high.
Hmm.
And so, and that's where we're seeing that any kind of increase in the heel elevation and other attributes
Okay.
of footwear increase.
So we
that.
got to fast forward. Amazing, like I said, this 30 minutes goes by quickly, doesn't it?
Yeah.
So we got to fast forward. So we identified the problem. We talked about how our shoes can impact us. For the listener, for the observer, for the Instagrammer over here, what do we do about it? Do we just get rid of our shoes and walk around barefoot and go back to the era of the caveman? But in this day and age, we don't walk on the tundra or grass all the time. We're walking on concrete and asphalt, and we're walking on buildings we're walking on hard surfaces. So what did you come up with? What's the solution? Help us out. What do we do?
Well, that's why I went and built a factory to make shoes.
Okay. So you couldn't find a shoe, so you needed to make one.
Right.
Okay.
Yeah.
Okay.
There wasn't anything there that I feel comfortable in, and I didn't want to go barefoot. I think this day and age there are materials out there we can make a better shoe.
Yeah.
But we need to understand sort of the biomechanics, and we only touched upon the heel elevation, but there are other attributes of a footwear that also abnormally increase those.
Right. So in your shop, I noticed that the way you create the shoes, and here we are, just a few minutes left. The way you create the shoes is you actually had to invent a system for creating these. So what'd you come up with?
Well, a whole new type of elastomer and 3D printing.
3D. So you're 3D printing shoes is what you're doing.
Yes, we are.
That's amazing.
Yes.
Yeah, and when I saw it in the factory, it's something amazing. You said the shoe that was on there, you hit the print button and the robot just goes there. The 3D printer goes, and after 42 hours, I think it was, bam.
Only six.
Oh, only 6. Where'd I get 42? I guess you can do 7 in 42 hours. All right, so 6
hours.
6 hours. 6 hours you can
Yeah.
knock out a shoe.
You can knock out a whole
A
pair.
pair of shoes.
Whole pair,
Okay.
ready to go. Yeah.
All right. So, hey guys, we have a lot more information to cover. We only have 30 minutes and our time is up. I hope you've got as much out of this as I have. For more information, Doc, how do they get a hold of you? How do they learn about your shoes and this factory and this amazing product you have here?
Oh, shoot. Go to our website,
Okay.
oeshshoes.com.
Oh, you should probably spell that out.
That's
Yeah.
OESH. So it's the word shoe, but upside down, inside out, something. Anyways, the word.
Oh, there it is. Okay.
OESH.
Okay.
And then the word shoes. So
OESH
OESH and then SHOES.com.
Yeah.
And everything's on there. We try to have the whole story on there, and